Hey, everybody, and welcome to our Tuesday live stream. Today we have Ari Parker, the co-founder of Chapter, with us, and of course, our producer Jill, who will help us navigate the questions. As always, many of the questions are nuanced, and we'll do our best to answer them, but they oftentimes can have more than one answer depending on your specific situation. The responses will be directional, and some of the information, we may require more information to give you a complete answer. So use this for educational purposes only, and seek the help of a qualified professional if you have specific questions that you need to talk to somebody about. Speaking of qualified professionals, we have 2.5 weeks until the end of the Medicare Annual Enrollment Period, and there have been a lot of changes this year, as many of you know, and Medicare, a lot going on. So if you have specific questions about your Medicare, give our partners at Chapter a call at 440-703-1224. I'll put their information on the screen right now so that you have it. And if you have any questions, give them a call. They'll be more than happy to help. All right, I think I've gotten the formalities out of the way. Why don't I pass it over to you, Jill, to lead the way?
All right, great. So we definitely have a bunch of questions that have been emailed in, but we do also encourage you to write into the chat box. Ooh, where is my chat box, actually? I don't have a chat.
I've got it up.
Huh?
I've got it up too. Huh. People are saying hello. Nice. Good evening.
I don't have a chat box here. Well, I will start with with our emailed questions, but we do encourage you, please, to send in all of your questions, and we will take those live as well. And as I get started with a Medicare question, Jeff, if you might want to step in and just check on my chat box, that would be great. I don't have one.
No problem.
It'd be hard to moderate without a chat, without the chat, but it is working for me. So I've got it. I see Paul just left a message. Doug put a thumbs up emoji. Melody said, good evening.
All right. Well, we will start with the emailed questions. There's many for you. So starting with a Medicare question. All right. Marvin is asking, I will be 65 in April. Am I required to enroll during this enrollment period or after my birthday?
Marvin, there's nothing you need to do right now. Your period will begin in January when you're 3 months from turning 65. So with an April birthday, there's nothing for you to do right now. You can ignore all those commercials that you're seeing on television. It pertains to people who are already on Medicare. Your Medicare will begin April 1st by virtue of you turning 65. And happy upcoming 65th birthday.
All right, let's go to the next one, which is from Steve. My wife and I are 68. I'm retired and enrolled in Medicare Part A. For the past 8 years, we've relied on her VA federal employee health benefits coverage instead of Part B. She's retiring soon and plans to enroll in Part A only. Because our income would trigger high-income Part B premiums, we're considering staying on her FEHB coverage without Part B. However, we're concerned about potential late enrollment penalties for Parts B and D. Should we enroll in Medicare Part B at retirement or continue relying on FEHB instead?
I think you're making a savvy decision to only have Part A and use the FEHB insurance, because IRMA, which is the income-related monthly adjustment amount, would significantly raise the cost of your Part B and your Part D, because you'd be subject to 2 surcharges, a wealth tax on your Part B and a wealth tax on your Part D. So for high earners who have the option of FEHB, we oftentimes see that they choose not to enroll in Part B, just as you're doing.
All right, great.
Now, you did mention the late enrollment. Yeah, if you did change your mind later on, you would have a late enrollment penalty for Part B, but FEHB retiree coverage is very strong insurance. And so I think you'll be all set.
Okay, great. And once again, I do now have a chat box. So please do put your questions into the chat box, and we will be taking those live. Looking forward to those. Okay, so next question is from Paul. Medicare question. I'm 67 and my domestic partner is 66. I'm still working and we're both covered under my employer's health insurance plan. Neither of us enrolled in Medicare at 65. Should we have signed up then? And should we sign up now? If so, what parts of Medicare should we enroll in?
So this is a Medicare Jeopardy question because of the way the Social Security Administration treats domestic partnerships for the purpose of being creditable for delaying Medicare. So as things stand right now, they don't recognize domestic partnerships for the purpose of delaying Medicare Part B for the spouse, for the non-working spouse. So the non-working spouse should go ahead and enroll in Medicare Part B ASAP. So that way it reduces the Part B late enrollment penalty that you might be subject to unless you personally have had creditable work provided coverage, which means 20 employees or more. So let's bucket this one because it's a very unique situation due to the domestic partnership dynamic and the way the Social Security Administration treats that.
All right, Jeff, there is a question for you from Keith. When I retire at 62 next April and start taking Social Security and say I make 30,000, if I put 6,000 in my 401k, does that bring my taxable income down to 24K?
Unfortunately, not for Social Security. Social Security looks at your income before your 401k contribution. So 30,000 will be over the limit. The limit for 2026 is $24,480. So that's your bogey. I will say your first year, there is a monthly test versus an annual test. And so whether that makes a difference for you or not, I don't know. If you're retiring or if you're drawing Social Security mid-year and for some reason you're in more in the beginning of the year than the end of the year, that might help. But unfortunately, no. Your 401k contribution is counted as part of your income for Social Security purposes.
All right, great. Phyllis has a Medicare question for Ari. I'm enrolled in Medicare Part A, work full-time, but will transition to part-time in February 1st, 2026. I will have prorated benefits. Do I need to enroll in Medicare Part B or a managed care plan?
The answer is yes. The only exception to delayed Medicare is for those who are actively working full-time or on their spouse's full-time work provided coverage. So when you transition to part-time, you will need to move to Medicare, and Medicare will be your primary insurance.
Okay, great. Jeff, there is a question, a Social Security question from Goodson. My wife of 17 years passed away at age 53. She earned enough credits for Social Security. I was 46 and I'm 59 now. Can I claim spousal benefits and work to full retirement age before claiming my benefits?
You can't claim spousal benefits on your deceased spouse, but the good news is you don't have to. So the survivor benefit is a strong benefit, and in fact, most people would look at that and say, given the dollars that you're talking about, you're gonna come out ahead. But the reason it's so strong, so the survivor benefit, let me step back. You assume your partner's Social Security payment at their own full retirement age if they haven't filed for Social Security, less when you file for Social Security. So if you're not at full retirement age, there's going to be a discount. If you're at your own full retirement age, then you get 100% of their full retirement age benefit. However, you can delay one and let the other grow. The caveat to that is that you can only let the survivor benefit grow until you reach your own full retirement age, whereas you can let your personal Social Security payment grow until you reach age 70. So a strategy that a lot of people use, particularly if the incomes are similar, is to claim the survivor benefit and let your own benefit grow. And because that's the one that can grow up to age 70, assuming your payments aren't too dissimilar from one another.
All right, great. Melody has a Medicare question. I turned 65 in June, but I pay for my medical, etc. Am reviewing 4 years to stay on what I have and wanted to know how that will affect me when I have to enroll in Medicare.
Great. Let's do a cost comparison. So grab a sheet of paper and we can compare. Now that the 2026 numbers have been released, we can do a comparison of what you would get if you were to transition to Medicare in June, which, by the way, anyone who's past 65 and on their work provided coverage, you can drop your work provided coverage and start Medicare if you choose. Medicare is excellent health insurance. So here's how it would work for Melody. So in June, if you were to transition to Medicare and enroll in Medicare Part B, your monthly premium would be $202.90 per month. That is the standard Part B premium. If you're a high earner, you'll pay more for Part B. A high earner is defined as someone who earned more than $109,000 modified adjusted gross based on their 2024 tax return. That's for solo filers. For joint filers, it's $218,000 modified adjusted gross on your 2024 tax return. So if you earn more than those threshold amounts, then you'll be subject to a higher Part B premium that the government will assess to you. So that's Part B. What you get in exchange for Part B is 80-20 coinsurance. The government picks up 80% of your medical expenses. You owe 20% out of pocket, and sky's the limit on that 20%. So that's where you need some type of additional coverage. And here you have two options. Option one is Medicare Supplement, which is also known as Medigap. This is the most comprehensive and flexible type of coverage. It's networkless. It allows you to see any doctor nationwide who accepts Medicare. If you go this route, you would just need a standalone prescription drug plan. That's option one. Option two is Medicare Advantage. Medicare Advantage is what you see advertised on television right now. This is an insurance company. This is when a private insurance company steps in and administers your Medicare Part A and Part B. And oftentimes these plans come with drug coverage bundled in. Now, what people like about Medicare Advantage is that many of the plans have a $0 premium. What people like a lot less is that it's managed care. It's subject to network restrictions. It's subject to the insurance company's terms and conditions. There's hundreds of pages of terms and conditions for each plan. And it also might be subject to prior authorization, which means the insurance company gets a veto over the healthcare that you can receive. And there were over 50 million prior authorization claims in 2023 alone. So if you transition to Medicare in June, then you would either choose option one or option two. They're mutually exclusive as your additional coverage. So what I would be curious about is, one, how much is deducted from your paycheck biweekly for your insurance? And two, how strong is that insurance? What are your deductibles? What are your copays? Do you like the coverage? Does it have a strong network? And so that would be a great starting point in order to compare whether you should start Medicare or not.
Nice, really thorough. All right, we're going to go back to the email for a question from Jeffrey on Medicare Part B penalty. Several years ago, when I first became eligible for Medicare, I felt overwhelmed by all the companies contacting me. I decided to enroll in Part A only because Part B would have cost over $500 per month due to my higher income at the time. Looking back, I now understand that the premium could have been adjusted to reflect my much lower retirement income. Since turning 65, our medical coverage has come through one of the medical sharing organizations, and we pay for well visits out of pocket. Fortunately, we're both very healthy and have no ongoing issues. I'm now almost 70, and I've been told that because I didn't sign up for Part B when I first became eligible, I may face a permanent late enrollment penalty. Is there any reasonable recourse at this stage, and what would the penalty look like for someone in my situation?
Oof. I mean, this is why we do these live Q&As for questions like this one. there are big sticks if you don't follow Medicare's rules about when you need to apply. The only people who have an exception to delay starting Medicare past age 65 are those who work for a large employer or their spouse works for a large employer, which means 20 employees or more. So because you've waited almost 5 years in order to enroll in Part B, and Medicare insurance isn't considered creditable for the purpose of delaying Medicare, so unfortunately that doesn't create an exception, you're probably going to be subject to a 40 to 50% penalty on your Part B, because for every 12 months that you wait to enroll in Part B, there's a 10% penalty, and you've waited at least 48 months to enroll in Part B, so that's at least a 40% penalty. So I hate to be the bearer of bad news, but that's better than knowing a 50 or 60% penalty. So let's address it now. Let's get you enrolled in Part B and go from there.
Okay, good. So no time like the present.
Yeah, and these are the types of costly Medicare mistakes that we help people avoid every day. I saw someone who was subject to 110% late enrollment penalty. So I've really seen it all. And it's great that nothing major happened to you over the past 5 years when Medicare was supposed to be your primary insurance. So that's a big deal too, because I've also seen people go bankrupt because they didn't sign up for Medicare timely.
All right. Next Medicare question is, will I be able to remove my 25-year-old daughter from my current employer's health insurance plan once I retire in February 2026? Or is this a question for my HR department?
It's certainly a question for your HR department, but at a high level, you'll have the option of extending your dependent's insurance through COBRA. So COBRA will be an option if your dependent doesn't have coverage through their school, for example, or through an employer. You could also shop the dependent's options on the Affordable Care Act exchange, though we have seen that because the advanced premium tax credits haven't been extended by Congress, that the premiums have gone up substantially for Affordable Care Act coverage. The final option that comes to mind is to shop for a private insurance plan. Many of these would be like a skinny plan, as they're called. It would mainly be catastrophic coverage, but that could be helpful too if your dependent is in their mid-20s and pretty healthy.
All right, Buzz is asking, when I go on Medicare at 65 and TRICARE for Life becomes my Part B, what happens to my wife's coverage? She is 5 years younger.
They'll be offered bridge coverage through the Department of Defense. So I was helping a veteran the other night who was exactly in the very same predicament.
Okay, Mark Kaplan has a Social Security question. He's asking for clarification. What is considered gross income for IRMA? Oh, maybe that's Medicare. For IRMA calculation, Social Security, annuity, dividends, and interest on investments. I guess it's a combo question.
Jeff, it's modified adjusted gross income. So let's tag team this. Would you?
Sure. So I can take this because I just happen to have this exact data right in front of me. So you couldn't have asked a question at a better time. But let me go to that information in 1 second. Bear with me. There it is. It's coming up now. So modified adjusted gross income is adjusted gross income plus tax-free interest. So the question most people have is, what is adjusted gross income? It's wages, taxable Social Security benefits, traditional IRA withdrawals, 401k, 403b, and TSP withdrawals, dividends, interest, capital gains, rental income, business income, unemployment income, pensions, and annuities.
Wow. There's a lot in there. All right. Do you have anything to add to that one?
No. But you can appeal. You can appeal. You can use Form 44 to request the government look at a more recent year because it is a 2-year look back. So if you've had a change in life circumstance, the two most common are work stoppage or work reduction. Sadly, the third most common is divorce. But if you have one of those 8 life-changing events, you can appeal and instead request that the government look at a more recent year. And it's something our team has a lot of success with, is helping you appeal your income-related monthly adjustment amount, your IRMA. And it can save $10,000 to $12,000 for a couple if they win their IRMA appeal.
All right, great. Now, Rick is asking a Medicare question. When I look online to compare my options during open enrollment, the cost of my supplemental plan looks the same for 2026. Should I dig deeper into the Medicare site check for other changes?
Medigap is standardized. So Medicare, Medicare supplement and Medigap are synonymous terms. So it's like calling the state of California the Golden Bear State. They're one and the same. So each Medigap plan letter type is standardized. Plan G is Plan G. It will cover the same hospital and medical benefits, no matter which insurance company you choose. So what the carriers are really competing on is price. And it's not just the upfront price, it's also the price over the long haul, which is something that we talk through when you work with us one-on-one. So if you'd like that type of price track, it's great that you're doing your research on Medicare.gov. If you want a second opinion, we'd be more than happy to give you one.
All right, great. And the phone number is on the screen. So if you want to give Chapter a call for that very reason, there is the number. All right, Cynthia is asking, my husband is 68. I'm turning 65 in January. We are currently on his employee insurance. Ooh, sorry, it just moved. We pay $700 a month plus copays and deductibles. Should we both take Medicare? Can his be secondary? Dentist, eyes? We earn less than $150,000.
This is Cynthia's question, right?
Yes. Husband 68. She's turning 65 in January.
Cynthia, the math would say you should start Medicare, both of you. $700 a month is a lot of money for your work provided coverage. If you and your spouse were to start Medicare, it would be $202.90 each because you're under that $218,000 threshold. And then the world is your oyster. You could choose a Medicare supplement and a standalone prescription drug plan, or you can look at your Medicare Advantage options. I would certainly, my mind is exactly where yours is. I would be thinking about starting Medicare for a January 1st start date and coming off your spouse's work provided coverage.
Okay, Phyllis is asking also a Medicare question. Sorry, Jeff, tonight's a Medicare night, it's looking like.
We're getting close to the end of the annual
we're getting close to the
period,
deadline.
and I saw the questions coming through, and I thought I'm going to have a pretty easy time tonight.
Yep. Well, here we go. We got lots of Medicare coming through. I'm enrolled in Medicare Part A, work full-time, but will transition to part-time February 1st, 2026. I will have prorated benefits. Do I need to enroll in Medicare Part B or a managed care plan?
I think we addressed this one. Because you're moving to part-time status, the answer is yes. You need to start Medicare.
Oh, it's in here twice. Interesting. Okay, Mark is asking, can you apply for Medicare Part B and appeal at the same time based on work stoppage?
So what Mark is referring to here is using Form 44 to reduce his income-related monthly adjustment amount. He's using Form 44 to appeal his IRMA, which is totally valid, but you want to wait until you actually have activated your Part B. So you want to first apply to enroll in Part B. It's a really simple DocuSign form. And if you need it, we'd be more than happy to share it with you. So first you activate your Part B. We wait a few days. The government's been very fast, actually, at processing Medicare applications recently. It's been impressive to see. And then after your Part B is issued, that's when we would go ahead and help you appeal your IRMA and find the additional coverage of your choosing.
Okay, I'm going to give you one from email now from Bruce. He's looking at Medicare re-enrollment help. Is there any AI tool that can help guide the Medicare re-enrollment decision? There's so many variables and personal situations that it's hard to know what questions to ask or how to present my unique needs. I'm imagining a decision tree style questionnaire that could help identify the right coverage. My insurance company, HMO, for 2026 has been completely gutted, and I need a plan that offers strong dental coverage for major work I've postponed, plus good vision benefits and preventive care. Is there anything out there that can help?
Yes, I would say we built a platform that would work exceptionally well at addressing this type of situation. It's based on your 3 Ps. Your 3 Ps are your providers, what doctors you want to see for the upcoming year. If you're on Medicare Advantage, we need to make sure that all of those doctors are in network and all the institutions that you'd want to go to. The second P is your prescriptions, what medications you take, brand name, generic, what pharmacy you like to go to. That matters a lot as well. Is direct mail acceptable, for example? That can help save you money. And then the third P is your priorities for the upcoming year. Is it a big travel year? Do you have a grandchild on the way? Are you moving to a different state? All of that is what our advisors have at the touch of their fingertips. And that's something that they'll discuss one-on-one with you.
Okay, great. I love the 3 Ps. It's easy to remember. Providers, prescriptions, priorities. All right.
Yeah, because one more thing on this. This is it. There's hundreds of insurance companies offering thousands of plans. There's over 24,000 plans nationwide, and it varies zip code by zip code across the United States. And our advisors have all that information at the touch of their fingertips. Now, if you don't want to use our team, I would just encourage you to go to medicare.gov, or you can call them at 1-800-633-4227, but just make sure that you review your coverage by the December 7th deadline. If you're already on Medicare, that's where your mind should be. You have 2.5 weeks left, as Jeff mentioned at the outset.
Okay, great. The Texas Rascal is asking, I'm 75. I still work full time, but I'm getting ready to retire. I've always been enrolled in a company medical plan. We have more than 50 persons enrolled. How do I get started?
So Texas Rascal, if you're planning, I love that name. If you're planning to retire in the next 2 or 3 months, now is the time for us to help you activate your Part B. Then we'll walk you through your options for additional coverage. We'd be delighted to help you. In order to activate your Part B, it's a real straightforward form. Your benefit, your HR department, your human resources person just needs to fill out a 1-page form and sign at the bottom. And then you return that to the Social Security Administration, and that's how you'll activate your Part B. And then we'll get into your options for additional coverage. And broadly speaking, there's only 2 options. I know I sound like a broken record at this point.
All right. Cynthia's asking, please explain the difference and advantages between Medicare Advantage and Medigap.
Okay, so this is great. This is the theme of the evening. And I think it shows just how savvy this audience is. So Medicare Supplement is also known as Medigap, and this is the most comprehensive and flexible coverage that you can have. It's networkless. It's better than a PPO. You can see any doctor nationwide who accepts Medicare, or go to any institution nationwide that accepts Medicare, as long as they're accepting new patients. Medigap is standardized under federal law. So the most comprehensive letter type for someone who recently turned 65 is plan letter G. G as in the way Jeff spells his name. G as in gold. If you go this route, then you would just need a standalone prescription drug plan. Now, the downside is there's a premium, and the premium can be substantial depending on where you live, though in most states, it doesn't cost an arm and a leg. It typically will go up gradually as you age, though it depends on the insurance company that you choose. The advantage is cost certainty. So if you choose Plan G, then for 2026, your deductible will be $283 for Medicare Part B. That will also be your maximum out of pocket, $283 for the entire year. And for someone who has a $6,000 deductible, I cannot wait to turn 65 and to sign up for that type of coverage. The second option is Medicare Advantage. This is what's heavily advertised on television right now. Joe Namath, William Shatner, Jimmy Walker, you could pick your favorite Medicare Advantage spokesperson. If you go with Medicare Advantage, the key is that all your doctors are in network, all your prescriptions are covered affordably, and that it meets your priorities for the upcoming year. And you don't want to just go off what your neighbor recommends, because you probably see different doctors and take different medications than your neighbors. So either option can work well. It just depends on your health. And here's what I mean by that. If you're interested in option one, Medicare supplement, then in 46 states, you have a one-time opportunity to sign up for Medigap without questions about your health history. And that coincides with the 6 months after you start Medicare Part B. Once you're outside that 6-month window, then in 46 states, you can be declined for Medigap, and then you'd be stuck with Medicare Advantage, unless you have a guaranteed issue right, which are few and far between. So at a high level, that's the difference between the two. I also write about this at length in my short book. It's not that complicated. I have a whole section on Medigap versus Medicare Advantage. So you might want to, thanks, Jeff. I know exactly what okay. I'm updating it. I'm working on the updated version right now for 2026. But if you want, you can email us. We'll send you a free copy of the book, a PDF, or you can purchase it for less than $10 on Amazon. And it breaks down the difference between the two in detail.
And I see that you have the title of it in your name here on the screen. So for whoever does not remember the name of the book, the name of the book is in the title by Ari's name. All right, to Jennifer.
Wait, Jill, real quick. Thank you so much. I wanted to get to Jennifer's question.
Do you see it? Because she said I've missed it, and I was just.
I know. I feel bad, and I can't find like where Jennifer asked.
I'm looking for it. Jennifer, if you could please re-put your question in, we'll get right to it. I see that you've mentioned we missed it, but I've gone back in the chat box and I don't see a question from you. So if you could put that back in, that would be great. And while we're waiting for that to come in, let's take John's question. Does IRMA get automatically adjusted after I file my IRS taxes at year end?
Well, it's a 2-year look back. So the government's looking for 2026. The government's going to be looking at your 2024 return, which you've already filed, and they have it. And so that's what they use as the basis for calculating whether you're subject to IRMA in the first place. So if you instead would like the government to look at 2025 or even your anticipated income for 2026, that's what Form 44 is for. I hope that answers your question.
Okay. Here I see Jennifer's question. I turned 67 mid-year 2026. Plan to start Social Security, but keep working. When can I file for independent divorced spouse benefits on my ex's Social Security? A question for Jeff.
Sorry, I was waiting for Ari to answer. Let me put myself in the full position. And Jill, can you ask me that question one more time?
Absolutely. A Social Security question coming in from Jennifer. I turned 67 mid-year 2026. Plan to start Social Security, but keep working. When can I file for independent divorced spouse benefits on my ex's Social Security?
So you have the spousal benefit, the ex-spouse benefit, the divorced spouse benefit has a 2-year window where you have to wait for your ex-partner to file before you file. After 2 years, most people think that I guess the politicians were in their infinite wisdom, they decided that after 2 years was the appropriate time where we were finally apart and completely apart. So after 2 years, you don't have to wait for your ex-partner to file for his or her Social Security, and you can file for the ex-spouse, the divorced spouse benefit at any time after 2 years without them filing.
All right. An email question of Medicare after layoff from Julia. I was recently laid off from a large corporation at age 65. My employer health coverage ends on January 30th. And although I plan to work again until age 67, I probably won't find a new job until spring. When should I apply for Medicare to make sure I'm covered during the gap?
Yes, I would apply for a February 1st Medicare Part B effective date, ASAP. You can do that now. You're in your window. And then if you return to work and it's a large employer, which means 20 employees or more, rule of 20, you can drop your Part B and go on that work provided coverage.
All right, perfect. Oh, someone's asking, Jeff, can you hold up the book one more time? All right, It's Not That Complicated by Ari Parker. And you can get a free copy. How can you get the free copy, Ari?
We can just email, we'll email it to you. If you connect at askchapter.com, we'll send you, if you just put Ari's book or something to that effect, we'll email you back with the book.
Okay, great. And someone's also asking if you can kind of just re-mention the 3 Ps.
The 3 Ps are your providers, what doctors you see, what institutions you want to go to. The second P is your prescriptions, what medications you take, brand name or generic. The dosage matters, the frequency matters, and of course, what pharmacy you want to go to, whether direct mail is acceptable. And then the third P is your priorities for the upcoming year. Do you own a second home in a different state? Do you plan to travel internationally? Do you have a grandchild on the way? Do you own an RV or a motorcycle? All of that factors in as well. Are you going camping in Alaska? I've seen it all.
All right. So D. Blungum is asking, I'm 65, retired 4 years, just started on Medicare October 1st. Not sure when I will collect Social Security benefits. Do I need to do anything else prior to collecting Social Security benefits whenever that time is? Social Security question.
I think that is a Medicare question. If I'm not mistaken, they're asking, what do I do with Medicare? I think they're asking if I don't have Social Security for them to draw my premium from, what do I do? Was that the way you heard that, Ari?
I wasn't sure. Okay, let's treat it like that. So here's how it works. If you're not yet taking Social Security when you first start Medicare, they're going to invoice you. And they're first going to send you 1 monthly invoice for the Part B premium. And then they're going to follow up shortly thereafter. And if you're a high earner, they're going to say, we looked at your tax return from 2 years ago, and you're subject to the income-related monthly adjustment amount. And you now owe us this sum of money. And it can be a lot of money if you are, it's a bracket. And they just published the numbers for 2026. Again, this is based on your 2024 tax return, though. Then you set up Medicare Easy Pay, so you don't miss a payment to Medicare. Once you start Social Security, they will deduct your Medicare Part B premium from your Social Security check. Until then, however, they will invoice you on a quarterly basis. And in order to make sure that you don't miss a payment until you take Social Security, set up Medicare Easy Pay through your Medicare.gov portal. It will take you less than 60 seconds to do. And if you miss a payment to Medicare for your Part B, they will terminate your Medicare. They will cancel it. I've seen it happen way too much. So don't miss a payment to Medicare. Even if you disagree with what they're trying to charge you, still pay it and then fight it after the fact.
Okay, great. Stargazer is asking, did I just hear you say if you're working part-time with health coverage from employer, you have to sign up for Medicare 65 next February?
Yes, that's correct. That's absolutely true. The only exception to delay Medicare is for those who are actively working full-time, or your spouse is actively working full-time. And it has to be an employer with 20 employees or more, rule of 20. So thank you for emphasizing that point.
Okay, Nettie Schmidt is asking, I signed up for Medicare A and B the next month. I went to an Advantage HMO. Can I switch back to original Medicare in the future?
Yes, you can. You can do it right now, actually, and you have until December 7th. That's exactly what this time period is for.
Okay, great. So that's a timely question. John Endres is asking, does IRMA automatically get adjusted after I file my taxes, or do I need to apply for an exemption so close to the end of the year? I'm in the bracket of 5 of 6 due to being a high earner in 2023 and 2024.
So you can appeal using Form 44, and it sounds like you had a substantial, it would be a material change if instead they looked at your 2025 income. So if my suspicion is correct and you've experienced a material change that would lower your bracket, I would file a Form 44 appeal. You would need a life-changing event. There are 8. Having a really good year in the market isn't one of the 8. So it has to be work stoppage, work reduction, divorce, marriage, the list goes on. But if you have one of those, then yes, file the Form 44 appeal and hopefully it sails through. You should hear back from the Social Security Administration within 4 to 6 weeks, oftentimes sooner. And they will lower your IRMA if you win your appeal.
All right, Rick Larson is asking another Medicare question. I began Medicare on 9/1/25. That means the income look back will be bad for me for 2026 and 2027. I don't make much now. Is it worth applying for an IRMA adjustment or better to wait?
No, you should apply. Absolutely. That's what it's designed for. Exactly the situation like you described, where you started Medicare this year. So instead, you would be requesting that the government look at your anticipated income for this year. Now, if you're off with your anticipated income, don't worry. They'll come back and check.
Okay, Mark Kaplan is asking, when you retire and have a qualifying medical plan, don't you have 8 months to apply for Medicare B special enrollment period? Wouldn't it make sense to wait? Annuity may be delayed 4 months.
So the viewer is right that technically there's an 8-month window once you come off yours or your spouse's large group work provided coverage in order to activate your Medicare. There are consequences, though, if you wait. Namely, what are you going to be doing for insurance in the interim? Well, let's walk through the options. Option 1, your work provided coverage. Well, you retired or your spouse retired, so that work provided coverage ended. So what is your insurance? You might say COBRA. COBRA is not creditable for the purpose of delaying Medicare. COBRA also is only secondary to Medicare. So even if you were to COBRA past age 65, if something happened to you, and I've seen this firsthand, I've seen this cost someone $70,000, your COBRA insurer will ask where was your primary insurance? Because Medicare is designed to be primary to COBRA, and you would not have activated your Medicare yet. So you wouldn't have had primary insurance. So the answer is, though you technically have an 8-month window, and yes, you can wait until month 8 of that window in order to sign up, you won't have insurance in the interim. And that's the big problem. You're going to have a gap in your coverage, and you don't want that because then you need to walk around in bubble wrap.
Okay, we have a few Social Security questions coming in. So Lisa is asking, I'm 65 now and have been on SSDI. When I turn 67, does this automatically convert to regular Social Security?
So we don't really have, we're not really discussing Social Security disability insurance in today's live stream. We will have a live stream on that. So let's put that one on the list for the Social Security disability live stream.
Okay. Okay, great. April also has a Social Security question. If I claimed Social Security early at 62, but wait until full retirement age to claim a spousal benefit. Will it be reduced?
So you claim your own Social Security at age 62 and then the spousal benefit at age 67. It will be reduced more than likely. And let me tell you why. There's a concept called dual entitlement. And basically, the Social Security Administration doesn't want you to game the system by taking a benefit without it impacting your lifelong number. So what they'll do, and I'll just use round numbers, let's say that your benefit is $1,000 and your spousal benefit would have been $1,500 at full retirement age. Well, if you take that $1,000 now and at age 62, that would be about $700. You're locking in that $700. So you're going to lose the extra $300. The only thing that continues to grow is the difference between the two. So it'll grow, but it won't grow as fast as it would if you waited. Now, people do the analytics on this and they say, you know what, that's okay because I'm okay with $300, losing $300. I'm not okay with losing a much larger number. And so in that instance, it might still make sense for you, but there isn't really a way to claim one benefit and then have it not affect the larger benefit, with one exception, and that is the survivor benefit, which we talked about earlier. You can claim one benefit, either the survivor benefit or your own benefit, and let the other one grow. Reminder that the survivor benefit only grows until your own full retirement age, whereas your personal benefit can grow up to age 70.
Okay, Cynthia has a Medicare question. If we both go Medicare, will we still be eligible for employee eye and dental coverage? And how about prescriptions?
Oftentimes you would still be eligible to get your company's dental and vision insurance. You would certainly want to check with your human resources department just to confirm. But I've seen many times where a spouse, where a working couple moves to Medicare and they still maintain their employer's dental and vision benefit until they're ready to retire. As for the prescription coverage, I think you would transition. If you go to Medicare, you would probably also sign up for prescription coverage through Medicare rather than getting the prescription benefit through your employer.
And Cynthia also said she needs to get the book. It's not that complicated. Though Elizabeth is asking Jeff, when is your book coming out?
Oh yes, Jeff, you need a book. It's true.
I'm working on it. I'm working on it. Every day I do a couple more pages. Look for something in 2026, and the announcement will come at the back half of the year. And it's about a third of the way done right now.
Okay, and John says he wants the book too, and he wants to know how he can get. It's not that complicated. I know
you can just email us at connect@askchapter.com and we'll email it to you. We'll email you a PDF copy of the book.
Okay, and we'll look for the book from Jeff in 2026. Stargazer is asking a follow-up question saying that working part-time with qualified medical coverage, do you have to sign up for Part B also?
If you're working part-time, the answer is yes. You need to sign up for Medicare unless your spouse works for a large employer and you have the option of joining your spouse's large employer health plan, which means 20 employees or more. I've seen a lot of questions tonight about working part-time past age 65. If you're working part-time, you need to enroll in Medicare Part B at age 65.
All right, lots of questions and comments about the book. There's a lot of interest in the book. Elizabeth just ordered it from Amazon, but John wants to know what email to send to get the book.
Is there? I wish I could type in the comments. Maybe I'll go in after but just connect@askchapter.com. And if someone could just put that in the chat, I think That would be great. I don't want to take away. We have 10 minutes left. I want to hit as many Medicare and Social Security questions as we can.
Okay. So Amiram Lee, Mr. Lee is asking, hi, I'm retired from the state with medical coverage I pay monthly for when I turn 65. Will I have to pay for Medicare as well?
It depends which state. Some states actually will reimburse you for your Medicare Part B, including California. So it really depends on the state.
Okay. Dawn is asking, I was discharged from the hospital with home health. I want to expand my options because I will need longer term care. Can I switch to open Medicare outside of the open enrollment period?
So the time to review your options right now, if you're already on Medicare, is the annual enrollment period. And that's what we're in right now. And you have 2.5 weeks. So I would encourage you, if you've been on a Medicare Advantage plan and it sounds like you're thinking about switching to original Medicare, then the question would be whether you could get a Medicare supplement plan or not. And if you've been recently hospitalized, it might be tough in 46 states unless you have a guaranteed issue right. Now, we have been seeing that if your plan is being terminated December 31st, then you have that golden opportunity to switch to Medigap without questions about your health history. In fact, you will have received a letter from the insurance company that's terminating your Medicare Advantage plan saying, hang on to this letter. This letter entitles you to a Medicare supplement plan without questions about your health history. Make sure you hold on to that letter if you're interested in switching to a Medicare supplement plan. And you have until you would definitely want to probably get that coverage in place for January 1st. So that way you don't owe 20% out of pocket for your medical expenses with no ceiling on that 20%.
Okay, I want to make sure that we address some more of our emailed questions. So Bob is asking, I'm 64 and already receiving Social Security. I retired with full medical benefits, and when I start Medicare in April 2026, I'm told my current group health insurance coverage will become supplemental. Do I need to contact Medicare with my insurance information? Also, will any IRMA adjustment be deducted directly from my monthly Social Security payment?
Yes. So because you're already taking Social Security, the government will bill you for Medicare Part B each month through your Social Security. If you have IRMA, they'll also bill you for those surcharges through a Social Security deduction.
Okay, Donna's asking, I'm retiring on February 13th, 2026 at age 66 and 6 months. My full retirement age is 66 and 10 months, and I plan to live on savings until turning on Social Security in mid-August when I reach full retirement age. My husband is 70 and already collects Social Security. He's also activated Medicare Part A at 65 by accident. Both of us are currently covered under my employer's health plan, which has more than 100 employees. My HR director recently sent me the forms to complete when I enroll in Medicare Parts A and B. On the employer verification form, it simply states that I'm still employed, but my retirement date isn't listed. My last day is February 13th, and HR says my employer coverage continues through the end of February. I want to be sure that Medicare and our wraparound coverage begins on March 1st. When should I submit everything? How long does approval take? Should I wait until after the busy general enrollment period ends? And when should I reach out to Chapter to set up the supplemental wraparound coverage for both myself and my husband?
Wow, this person is super prepared. And the answer is you can submit the paperwork as early as December 1st in order to get a March 1st Part B effective date for you and your spouse. So you can submit everything December 1st. And look, the reality is you have time here. You can do it anytime in December. You're going to get all that coverage set up for March 1st. So right now, the mad rush is for people who are already on Medicare. So 72 million people are deadline constrained, and they have until December 7th to review their coverage for the upcoming year. So if I were you, I might wait maybe a week and do it in mid-December. You're still going to get everything well in advance of March 1st. But the early bird gets the worm. So great job being prepared. And then you did have, I did note that you probably were wondering about how your HR person filled out that form L564. I would probably have them put the date that your work coverage is ending. They can make that minor tweak and initial it on the form. It wouldn't be too much to ask of them to just put the date your coverage is ending. And then in the remarks section to when you submit the paperwork to Social Security, I would just spell it out and put for a March 1st Part B effective date.
And can I just jump in here? So if you're this is related to the Social Security comment that you made. If you are reaching full retirement age in 2026, your full retirement age is age 67, not 66 in 10 months. I don't want you to lose 2 months worth of growth on your Social Security payment. In 2025, it's 66 years and 10 months. In 2026, it's 67.
Nice clarification on that.
Wow.
Yeah. Okay.
Going up.
Yeah. Changes for 2026. All right. We have 4 minutes, but we have lots of questions. So let's keep barreling through.
Rapid fire.
Yeah. Mark is asking, I carried my FEHB into retirement. Makes sense to delay till early 2026 Medicare Part B due to the 8-month special enrollment period. Oh, that's a comment. Okay.
Sure. That makes sense.
Yes. Okay. What is the time frame for pre-existing conditions?
So in 46 states, I think what this questioner is asking about is they're saying, all right, Ari, you mentioned 2 options. Option 1 is Medicare Supplement. Option 2 is Medicare Advantage. For option 1, I know that in 46 states, I'm time constrained as to when I can get Medicare Supplement without the carrier asking about pre-existing conditions or my recent health history. And so if you know that you want option 1, the time to obtain Medicare Supplement is when you first start Medicare. Because in 46 states, you have a one-time opportunity called your Medigap Open Enrollment Period in order to sign up without questions about pre-existing conditions or your recent health history. The only 4 states that are the exception are New York, Connecticut, Massachusetts, and Maine. So they're all along the Northern Atlantic seaboard.
Okay. Cohort 61 says, my spouse is 7 years younger than me. She plans to work until her full retirement age. Can I put off enrollment until she retires and no longer has employer-sponsored coverage?
The answer is yes, as long as the employer has 20 or more employees.
Okay. Charlie is asking, started Medicare recently, covered under my spouse's insurance for Part B. When she retires, how far ahead do I need to contact them to start up Part B?
2 to 3 months before your spouse is ready to retire would be a great time to activate your Medicare Part B.
Okay. And Brian is asking, if your Medicare is subject to IRMA increase, will Medicare supplement fees be increased also?
No, it's not. The IRMA applies to your Medicare Part B and your Part D surcharge, and that's assessed directly by the government. Your Medicare supplement premium is not means tested. It's not based on your income.
Okay, John's asking, my full retirement age is 66 and 10 months, August 2026. Am I allowed to make unlimited money as of January 2026, the year of my full retirement age, without penalty?
So your full retirement age in 2026 is going to be age 67, not 66 years and 10 months. A lot of people think that because that's what it is this year. Once you reach full retirement age, as it relates to Social Security anyway, you can earn as much as you want, and there is no clawback provision. At full retirement age, you can earn $1 million a year, and they got to pay you your full payment.
Okay, we are at 8 o'clock at this time. We still have some more emailed questions. We will keep those questions. Those will come to you next week as well. We will continue going through all these questions and try to get everything answered. So I'm just going to turn it back over to you, Jeff. And thank you so much for all this engagement in the chat box. This has been really
yeah.
So
Yeah, this is our best one yet.
This was great, and Ari and Jill, thank you so much. Ari is a regular on the channel now, especially during the annual enrollment period. Gang, it is 2.5 weeks, and if you are like millions of people who has had a big switch in your Medicare plan this year, I highly recommend that you call our partner at Chapter, even if you feel comfortable with what 2025 look like, because things do change. It's totally free to you. It doesn't cost you anything to have a discussion with them. It takes about 20 minutes, and they save their clients an average of about $1,100 a year. So it is a big savings. You don't want to wait until the last minute, though. You don't want to be calling in two weeks and a day from now. You want to get as much lead time as possible. So give them a call at 440-703-1224 if you have specific questions about your situation. With that, I think we should wrap it up. Thanks everybody for staying late with us. This was great as always. And as I said, Ari, Jill, thank you so much. And we will see everybody next time.